So first of all, we're going to get into the details of the vertebral column, and we know it's basically the bony architecture, which is basically providing the protection. The basic and the foremost function of the vertebral column is to provide protection to the spinal cord. And as well as it is basically one way of transmitting weight towards the lower limbs. It is even providing the stability to the pelvic girdle as well as the shoulder girdle. And because of the multiple joints that even you can observe over here, these multiple joints basically make it more feasible for performing different movements as well as maintaining the posture of an individual. So all of these qualities and all of these properties that this vertebral column has, we're going to get into the details of this bony architecture first of all. Now, just to give you the basic background knowledge regarding the vertebral column, we must know that first of all, inside the neck region, almost in the neck region, we have a set of vertebrae which are basically known as the cervical vertebrae, and they are over there forming the cervical spine of an individual. So this neck region is basically providing the movement. The cervical spine is basically providing the movements, either the flexion, extension, or whenever there is a right or a left movement or lateral movements, they are being possible because of this cervical spine that is present over there. And as well as there is a very important joint that the cervical vertebrae makes with the base of the skull. So even the nodding movement of the head that is being performed, it is due to this joint that is present between the cervical vertebrae and the base of the skull. So all of these movements are possible due to these multiple joints that are present throughout the vertebral column. Then moving on, we have the thoracic spine over there. Almost 12 vertebrae, they contribute towards making up of this thoracic spine, and the basic function of this thoracic spine is to maintain the posture of an individual, that upright posture that all of us are able to maintain is due to the fact that this thoracic spine is providing the stability, and the muscles of the back are being attached at the spinous processes, and that is basically providing the overall posture in an individual. Moving on, we have the 5 lumbar vertebrae, and they have their own function to perform. Apart from maintaining the posture, apart from making the possible movements in that lower limbs, it's also basically responsible for transmitting weight towards the lower limbs. So this is the important function that they're going to perform as well. And then we have the 5 sacral vertebrae, and usually these sacral vertebrae are in a fused form. So the joints are not quite visible over there. The movements are not quite advent in this particular sacral region. And then we have the tail vertebrae, which are also known as the coccygeal vertebrae. There is a joint between the sacrum and the coccyx, which is basically the sacrococcygeal joint, and it has very least or restricted movements that it can make over there. So this is the whole organization of when we start off from the cervical end and move towards the tail end, and we'd be reading and we'd be going into the details how the softer parts, they basically coordinate towards this bony architecture. The surface anatomy is usually related to this bony architecture, and so the thorough knowledge of the bony architecture is very important over here. So this is the complete details. We have the 7 cervical vertebrae, and obviously we have the nerves that are coming out of this vertebral column. So there are almost 8 nerves that are coming out of this vertebral column, and basically it's again very important how you calculate which nerve is going to correspond to that particular area. A very easy way how you can remember this is you have to, for cervical for the cervical spine, what you have to do is you have to add one. For instance, the spinal nerve that is going to come out of this particular area out here is, it is going to be the second cervical, it is going to be the second cervical nerve that is going to come out of here. So it's not basically going to correspond towards that particular segment that we're going to discuss. And the rule of thumb is basically you're going to add one to that particular vertebrae. Regarding the thoracic vertebrae, the rule is quite different. Over here, when you have to calculate which nerve is corresponding to that particular vertebrae, what you have to do is for the upper thoracic vertebrae, you have to add 2. So if it's the second thoracic vertebrae, the nerve that is going to come out of that particular segment between the second and the third vertebral column, it is going to be the fourth thoracic nerve. So you're going to add 2 for the upper thoracic vertebrae and you're going to add 3 for the lower thoracic vertebrae. You have to just remember this formula while you're calculating which exact nerve is corresponding to the vertebral column. Moving on, when the 10th thoracic vertebrae, it is basically corresponding with the L1 and L2 cord segments. So this is something that you have to remember. It's really not corresponding. It's basically the 10th thoracic vertebrae, and the nerve which is corresponding to it is the L1 and the L2 segment of the spinal cord, and the nerves are basically corresponding in that particular way. Then moving on, we have the 11th thoracic vertebrae, which is corresponding to the L3 and L4. We have the 12th thoracic vertebrae corresponding to the L5 cord segment. Now, this is something which is very important when you're working as the physicians or you're working as in path labs, and you want to take samples of the CSF and you want to send them for cultures. You must know where the spinal cord is going to end. In the adults, the level where the spinal cord ends is almost at the level of L1. And in the children, it's almost ending at the level of L3. So this is again very important that you remember these cutoff points, because the usual sampling technique which is performed, by which we take out the CSF and send it for the histopathology, that is done at these particular levels, and these levels should be maintained. You must know, and you must maybe be well versed with the anatomy of the spinal cord, and you should take the CSF samplings at these particular levels. And this is again very important to remember. So now we have this background knowledge regarding the vertebral column, where we know that the cervical spine is consisting of the 7 cervical vertebrae. Then we have the thoracic spine with the 12 thoracic vertebrae, which have a different architecture, bony architecture. When we compare the cervical vertebrae with the thoracic vertebrae, there is a lot of difference, and even one can identify with the basic architecture that either it is a cervical or a thoracic vertebrae. And then we have the lumbar vertebrae. There are almost 5 lumbar vertebrae. Moving on, we have the 5 sacral vertebrae, which are usually in a fused form. And then we have the 4 coccygeal vertebrae, which are basically the tail vertebra. There is a joint between the sacrum and the coccygeal vertebrae, which is known as the sacrococcygeal joint, and a limited or restricted amount of movements are possible on this particular joint. So here's an animation which is basically giving you an overview of the vertebral column. It's basically a 3-dimensional view of the vertebral column. So as you can even see over here, here is the, first of all, we have the cervical vertebra, and there are 7 cervical vertebra, namely we have the atlas and the axis. The atlas is the first cervical vertebra and the axis is the second cervical vertebra, and then we have the other cervical vertebra which are not named specifically, but there is this specific bony architecture they have. When we compare the cervical vertebra with the thoracic vertebra, they are rather more flattened out, and the the vertebral bodies are rather flattened out when we compare them with the thoracic vertebrae out here. Moving on, we have the thoracic vertebrae, and we have almost 12 thoracic vertebrae out here from T1 to T12. Then finally, we have the 5 lumbar vertebrae. Moving on, we have the sacral bone, which is almost S1 to S5 in a fused form. Then we have the coccygeal bone, which is basically fused together. It is a tailbone, and there is a joint between the sacrum and the coccygeal tailbones, which is known as the sacrococcygeal joints. A limited or restricted amount of movements are possible on this particular joint, but that is, of course, in a limited nature. So now we're well versed with the general organization of the vertebral column and how we have this particular set of vertebral bones that are organized in the vertebral column, and they're basically giving way to the spinal nerves out there, and how we can basically relate to which particular spinal nerve is coming out of which particular segment in the vertebral column.